Welcome to the Longevity MD podcast, where we discuss all aspects of health optimization. This is William Berger, MD, your host. Hello, Dr. William Berger here from Northeast Medical Practice. So, wanted to chat a little bit about skin changes that can happen to women in the perimenopausal and menopausal time period. I get a lot of questions from my patients in that bracket who are concerned about how their skin is changing and ask me why and what we can do about it. So let's chat about that a little bit. So estrogen is protective of the structure and function of our skin, the skin of women, and it, of course, decreases greatly as women enter menopause. And once they pass through the perimenopausal period and enter menopause, it can be quite low. And this has multiple effects on the body, from basically increasing cardiovascular disease risk up to the level of men of a similar age. But today we're going to focus on the skin itself. So the skin has many different kinds of proteins in it. One of them is called elastin, which, as the name suggests, increases the elasticity, the flexibility, and its ability to return to its original shape. You think of an elastic band. And decreasing estrogen, much more so than progesterone, tends to decrease the amount of elastin that we have. It's disrupted. It doesn't work as well. And so the skin becomes less elastic. Of course, most people have heard about the protein called collagen, which is a major structural protein within the skin. And as it loses structure and function, you can have a lot of changes in the surface appearance of the skin. That is primarily the wrinkling that we see, more superficial wrinkling as opposed to deep lines that we can see as women enter this period of time and move through it. And the healing ability of the skin also decreases. There are a type of mobile cell that basically move around the body and repair wounded areas and lay down something called fibrin, another type of protein. So the cell is called a fibroblast, and they're kind of involved in repair work in the skin, and their activity goes down as well. Really just a tremendous range of changes, and you get disruption in many of the other growth factors that drive the fibroblast and other cells to basically maintain the quality of the skin and its structure, but also the fat pads that we have in the skin, and these are not from being overweight or obese. These are fat pads that give the youthful skin, the face of somebody who's young, that kind of plump, full appearance. Now, they shrink and descend as we age in men and women, and that, of course, can lead to sagging and jowling, and basically, instead of the triangle of the youthful face being with the point at the bottom, you get more of the triangle of the aging face that has the point at the top as things descend. And as I'm looking at myself in the camera, I'm kind of evaluating what I see as well. And yeah, we all age, don't we? So all of that is also being driven by what's going on underneath those fat pads. And we have fat pads throughout the face, and they all move and descend and shrink, like I said. But underneath that, you're also having bone resorption. So, there are some major bones in the face, like the maxilla, which forms the upper part of the jaw and then the middle of the face. Of course, it has an aperture and a hole in the middle called the piriform fossa. That piriform means it looks like a pear. So, it's kind of a somewhat triangular hole that, if you've ever seen a skull, you know what I'm referring to. And the bone around the edges of that can also become resorbed and thin. And as that causes basically a hollowing, an indentation, these lines called the nasolabial folds, and I guess it's convenient that I'm of a certain age because I can show you all these things and how they're happening. So those nasolabial folds, they get deeper as the fat pads descend, but also as the bone behind it in the maxilla around the hole for the nose, the piriform fossa, is slowly resorbed over time. And so this can lead also to jowling and the marionette lines, as everything tends to kind of descend as we get older. Structural changes in the skin, like I talked about, the fat pads, bone resorption, maybe gravity, I suppose, over time. What can we do about all of this? Well, in the 90s, thankfully, there was the invention of and popularization of a material called hyaluronic acid, which is a natural product in our skin. It tends to give us volume, and it does that by absorbing water, among other things. It gives you hydration. So applying it topically to the skin can help with hydration if you have dry skin. But what I'm referring to here are dermal fillers. So you've probably heard of the brand names, Juvederm and Restylane and so on. I do use the Restylane product in my office. It's my go-to. And by replacing volume that's been lost in the fat pads or volume that's been lost due to bone resorption, we can return some of that volume in the upper part of the face, and it can actually raise a little bit, decrease the depth of these lines, kind of bring you back some cheekbone, pull this up a little bit, also placing it filler here, kind of back toward the ear, over the bones that are called the zygoma. This is the zygomatic arch here. So you can put filler here, you can put filler back here, and that's going to do what I'm showing you on my aging face to make these lines a little bit less prominent, to kind of pull everything up a little bit. I use a filler called Restylane Lift, Lyft, for that purpose, because that's what it does. It's a relatively thick filler, thicker than what you would use in lips, for example, that gives you some of that volume and structure back that you're losing. And you can also put it in the jawline. You know, I know on Instagram and whatnot, younger folks like to talk about the snatched jawline, the Angelina-style jawline. I'm not really referring to that. I'm referring here to more for folks who are aging, and as bone is resorbed and fat pads are descending, you're getting that jowling effect here. And we can put filler along the jawline also to give lift and pull and reduce the prominence of the jowling. We can make the chin just a little bit bigger and fill behind the marionette lines too. A lot of things that we can do with this sort of magical product that has been out now for 20, 30 years, quite safe. And it's actually a synthetic version of a compound that's actually already in the skin called hyaluronic acid. So it does degrade over time. The body does break it down over time. It typically lasts certainly greater than 6 months, often greater than a year, sometimes more than that. And there seems to be a bit of an additive effect as well. In other words, you do a couple of syringes worth of filler, and then you do a little bit more. The second application seems to last much longer. This happens with neurotoxin, Botox as well, which I do in the office too. But that is more for these guys, forehead lines, the 11 lines or frown lines, and the crow's feet. It's a totally different mechanism. Botox works by essentially weakening the muscles. It's a neurotoxin. And if the muscles aren't as strong, you can't wrinkle the skin as much. And just to put it out there for younger folks, it can be somewhat preventive. For example, if I had been doing it in my younger days, I probably wouldn't have developed this deep line, which if you look closely, even when I'm not wrinkling my brow, raising my eyebrows, you can see that there's what we call a static line there, a line that doesn't go away when everything is still and the muscles are not contracted. So just a little sidebar there on neurotoxin and its benefits in younger folks to prevent the lines from happening in the first place. But if you haven't done it and you're getting into your middle years, it can help to just not create them when you do contract the muscles like I just did. So that's just a bit about the age-related changes in the face. In particular, they start to happen for women during the period of perimenopause and menopause as estrogen levels drop, because of all of those maintenance mechanisms of the skin that I talked about, elastin, fibroblast activity, collagen, all of this starts to basically fail. And hormone replacement therapy, I should say, doesn't really seem to correct all of that. You might think it would, right? If decreasing estrogen levels seems to be implicated in the process. However, there's kind of a mixed bag of studies in terms of the effect of hormone replacement therapy with estrogen and progesterone to improve the quality of the skin. Of course, all the basic lifestyle things that we should all be doing for 1,000 different reasons, such as healthy diet, exercise, proper sleep, controlling stress. Don't know how we do that very well in the United States. We don't do all those things very well in the United States with the way that we happen to live in our high stress, particularly working lives in this country. All of those lifestyle things get implicated and affected, and that's why we work so hard on them in our practice, because they're the foundation for health and longevity in general. But I digress a little bit there. Of course, they all help with the skin. Number one really is sun protection as early in life and as thoroughly as you can, with sunscreen, avoiding the sun in the first place, shade, hat, etc. Long sleeves. There are lots of light breathable materials that block the sun these days. If you're in the sun, at least an SPF 30 sunscreen. Above that, it really doesn't help. You get 95% of the sun protection at SPF 30. Make sure that it is not an organic sunscreen. Those can cause hormonal effects themselves, and they also don't block both UVA and UVB. So you want one that has either zinc oxide or titanium in it, because those physically block and reflect the sun's rays, the UV rays that we're worried about for not just skin aging, but preventing risk, decreasing risk for skin cancer, because of course, UV exposure over time from the sun, or I guess a tanning bed if you do that a lot, is the primary driver of cancer of the skin, non-melanoma skin cancer. So I'm referring to the common ones like basal cell carcinoma, squamous cell carcinoma. Melanoma can have other genetic mutation drivers and whatnot too, but also sun exposure as a driver. So regardless, and you've all seen people who spend way too much time in the sun. They kind of refer to themselves as sun worshipers. They love the sun. They won't stay out of it. They don't always wear sunscreen. They stay out all day long in the sun at the beach or what have you. And you can see the effects on their skin as they get into their 50s, 60s, 70s and above. They really look like they have been out in the desert their whole lives. And that thickening and age spotting and everything else is all being driven primarily in those people by UV exposure from the sun, plus age and all the stuff we talked about already that age does and how it affects the skin. So what can we do? Protect ourselves from the sun, make sure that we're not getting poor sleep and eating properly and all those kinds of good things. You can, of course, use a lot of topical things to hydrate the skin, things that have ceramides, that have hyaluronic acid. We can add volume and correct structure to a significant extent with dermal filler, and not really so much age-related or correct. Well, it's age-related, but not correcting structurally, but correcting through neurologic and muscular means, the use of neurotoxin like Botox, Xeomin, and Dysport. I happen to use Xeomin in my office, but other than those two relationships that I happen to use, the Galderma Restylane brand of filler and the Xeomin brand of neurotoxin, and I use the Xeomin for the reason that it seems to last longer ever since COVID. Botox and Dysport seem to have cross-reactivity with the COVID antibodies that arise either from infection or COVID vaccination. And because there's a little bit of cross-reactivity, they can bind to the Botox and Dysport molecules, and they don't last as long, it's in my experience. Xeomin has an additional side chain, a little compound added to it that seems to prevent this binding, this cross-reactivity with the COVID antibodies that we generate. And therefore, I have much better luck with it in terms of lasting 3 to 4 months or so, like all the neurotoxins used to. So other than that, I don't have financial involvement with the companies. I just utilize their products because I believe in them and I think that they work very well for my patients. The Restylane products I feel the same way about, or I wouldn't use them. So hope you enjoyed learning a bit more about what Father Time does to our skin. We discussed it primarily in the context of estrogen decrease in menopausal, perimenopausal women. Of course, for all the guys out there, that's happening to us too, not because we're losing estrogen, but just age and so forth, and wear and tear and sun exposure and all the things we talked about. And so there's certainly application for neurotoxin and dermal filler in men who are concerned about aging changes to their face, some of them, which I illustrated on my face during this video. Maybe I need to go get some work done, right? So if you'd like to learn more about what we do in our practice, it's a concierge-style internal medicine practice first and foremost, where we really focus on lifestyle and use medication as needed for controlling weight, but also I advocate for people in the hospital. I make house calls for an additional fee. We have a very thorough annual physical where I not only do a lot of lab work to evaluate for cardiovascular disease risk that's more in depth than the average internist and some cardiologists in this country, but also we screen very deeply and broadly for cancers through the Galleri blood test and whole body MRI, in addition to referring our patients to for mammography and making sure they get their GYN exams, men and women getting colonoscopy, PSA in men, if we discuss that we want to do that, and so forth. But we go way beyond the United States Preventive Services Task Force guidelines for cancer screening, because it's really only for a handful of the big cancers that have certain screening tests or procedures like a colonoscopy or a mammogram. But there are many, many more cancers to worry about. The Galleri blood test looks for dozens of them, greater than 50 at this time. And the whole body MRI is also looking pretty much head to ankle for anything that doesn't belong in the body. We're looking first and foremost for malignancy, but we're really looking for other issues as well, masses, cysts, basically degenerative changes in the spine and the joints and so forth. So both really great tools, not covered by insurance as of yet, unless you happen to be in the United States military where the Gallery blood test is covered by their TRICARE medical coverage. So that's the first instance of the Gallery test being covered by insurance, but you can see that if the government is worried enough about its military staff to utilize this test, then they must believe in it. And the data that are out there support its use. I know oncologists who use it too. And I'm going to do a podcast upcoming with an oncologist to talk about the benefits of these additional kinds of cancer screening tests. He happened to use the Gallery blood test in his office too. But when we get together, we will talk further about that. That podcast is the Longevity MD podcast that I host on Spotify. So you can find it there by searching for Longevity MD, like medical doctor. So everything that I've shared today, which is quite a bit, frankly, is for educational purposes only. We have not as of yet formed a doctor-patient relationship. And if you have specific questions or concerns about your health, you should, of course, not delay in reaching out to your medical professionals. But until we see each other again, watch the sun, take care of your skin, and have a healthy lifestyle so that you can look your best as well as feel your best. Take care. To learn more about Northeast Medical Practice or concierge-style health optimization clinic, please call our office at 516-604-3418 or visit us online at northeastmedicalpractice.com. The information contained in this podcast and other media derived from it is for educational purposes only. It does not constitute the practice of medicine or any other healthcare services or the provision of medical advice or treatment. No doctor-patient relationship has been formed. Users of this information do so at their own risk. For any concerns or questions, users are directed to seek the advice of their medical professionals. The song Vital Signs was written by Neil Peart, Geddy Lee, and Alex Lifeson of Rush. Performed here by Dr. William Berger.